The Hong Kong Society for Infectious Diseases was founded on the 4th of December 1995 as a coalition of healthcare professionals uniting against infectious diseases. HKSID promotes the advancement of the study of infectious disease while also keeping medical professionals and the community up to date with the latest developments in the field. The founding chairman of the society is the late Professor Li Shu-hung, a veteran in the public health field. He devoted over half a century to promoting and safeguarding the health of the public. His role in establishing the society is one of the cornerstones of his legacy to improve the health of all Hong Kong citizens. Another figurehead is the late Dr. Lo Wing Lok, JP, who passed away on the 9th of May 2015 at the age of 60, who also greatly contributed to the establishment of the society starting from 1996.
Our society will forever be indebted to the many contributions of Professor Li and Dr. Lo. Professor Li was the founding president of the society. It was his idea to set up the society to promote interspecialty collaboration, to promote research and training in infectious diseases, ultimately enhancing the level of care to infectious diseases. We will continue to honor their spirits by promoting research and training in infectious diseases and to educate the public about the threats of infectious diseases.
After 20 years of development, the Hong Kong Society for Infectious Diseases has become one of the most well-established medical societies in Hong Kong. The HKSID Council is made up of 15 well-respected members of the Hong Kong medical community. They have the important mission to safeguard the Hong Kong people's health. The Society has organized many scientific activities for members and the public to continuously raise awareness prevention of infectious diseases. Annual scientific meetings give members a chance to learn about cutting-edge research and gain new insights.
Annual scientific meetings are platforms where the Society can freely discuss all the latest developments from our own research and practice. Each year, we invite leading infectious disease experts from around the world to share their findings and generate an international dialogue. It's our flagship event and something I always look forward to.
Other events include hands-on workshops. In addition to enriching the knowledge of the medical community through scientific meetings and workshops, the Society publishes a bulletin which raises pressing issues with local colleagues. Other HKSID publications include AIDS Health, travel leaflets, etc. The Society's scientific meetings and publications are the culmination of both members and the Hong Kong health community's knowledge. The Department of Health was becoming increasingly concerned when 11 healthcare workers from Ward 8A of the Prince of Wales Hospital went on sick leave simultaneously. The infection was initially diagnosed as atypical pneumonia but would later become known as SARS. In a period of only 3 months, 1,755 individuals had been affected by the SARS virus in Hong Kong. Hong Kong experienced one of the highest attack rates in the world for SARS. By June, the last SARS case was confirmed and reported, and the World Health Organization took Hong Kong off the list of areas with a recent local transmission of SARS. After effects of SARS will be felt for a long time to come, the most painful of which will be on the families of the deceased. Additionally, the SARS outbreak had a major impact upon Hong Kong's economy during its months. The SARS epidemic in 2003 has underpinned the importance of strengthening interagency collaboration and communication in combating communicable diseases. Our experience from SARS and avian influenza shows that infectious disease could wage a war against humankind any time in the 21st century. Effective prevention and control of communicable diseases requires two major components: investing in healthcare infrastructure, and foremost, an efficient and sensitive disease surveillance system. The SARS crisis was a reminder to health authorities around the world of the need for a strong commitment in enhancing public health infrastructure and a closer international cooperation against communicable diseases. In line with the government's policy, the Center for Health Protection, Department of Health, was officially opened on the 1st of June 2004. The mission of the organization is to strengthen our preparedness and capability in disease prevention and control.
It has been a bitter but paramount lesson Hong Kong has learned from SARS. People in Hong Kong have developed far better hygiene practices, including frequent hand washings and cleanliness at home. Now, the medical community is much more equipped to deal with unknown viruses in crisis situations.
No one can erase the painful experience of SARS from our minds, especially those working on the front line at hospitals and clinics. Princess Margaret Hospital was then designated as the infectious disease center in Hong Kong, for isolation and treatment of SARS. Many of us work and lived at the hospital, not going back home to avoid any risk of infecting our family members and community. You can imagine how many anxious and lonely nights we experienced at the hospital, though it was for the better cause that SARS was contained at a single, well-managed site.
In 2004, a post-SARS review by the Hong Kong government recommended the need for surge capacity in the public healthcare system. The Legislative Council had approved funding for the establishment of the first infectious disease center in Hong Kong. Princess Margaret Hospital was then established as a major acute general hospital and Hong Kong's designated infectious disease center. Since then, the hospital has been managing various major kinds of infectious disease, including avian influenza, hospital-acquired infections, as well as tropical infections. Infectious disease teams are also established at different HA hospitals around this time as the first defending teams against infectious diseases. The Society will continue to be a pole star guiding the medical community and the Hong Kong people alike with the latest research and knowledge regarding infectious disease. The Society will continue to play a key role in advisory for infectious diseases crisis to the Hong Kong government and offer full support in dire straits.
We always welcome and encourage new members in the medical community to join the Society and be part of the quest for knowledge about emerging and re-emerging infectious diseases. There are many challenges ahead, though the Society will continue to spearhead research and implementation on new disease protocols. We hope that not only healthcare professionals, but also the community will be an active part of preventing the spread of infectious diseases for a healthier Hong Kong and a healthier world.